The strike is not just about pay. The strike is because our NHS healthcare staff are feeling undervalued and overworked. I mean, at the moment, if you are under the impression that people are safe, I'm willing to tell you with assurance they're not. The ambulances are taking 8 hours to get to people. People are having to use their own transport, even if they are worried about a heart attack, because it's easier to get to the hospital. The NHS is at breaking point. In fact, I would say that it's already broken. And what are the managers doing to amend the situation? What is anybody doing? I mean, they're nicely tucked away in their offices, while the frontline workers who are, your HCAs, your nurses, your doctors, they're facing all the abuse, and at the end of the day, they're being blamed for all the failures of the NHS and the ministers. So yes, we're under huge pressure at the moment, but I wouldn't say that it's the nurses who are at fault because they're walking out. They're walking out because people are dying every single day in A&E corridors because they're not getting help soon enough.
I'm with you, Dr. Anita. I'm with you. I see that the NHS doesn't work. It's not fit for purpose anymore. I see that it's on the brink of collapse if it hasn't already collapsed. I'm with you on that entirely. My question, however, is, it seemed to me that the strikes were about pay, but if they're about working conditions, fair enough. But what are the conditions we want to change? Do we want to get rid of this managerial structure, get rid of all the bureaucracy? What improvements do we want to see made to make the NHS work again?
Yes, to answer this question, I think all the health minister needs to do is spend 12 hours in any local A&E to see what needs to be done to make the system more workable. At the moment, we've got a funding issue. I understand that. But, at the same time, we've got to understand that nobody can work for free. Our nurses are going to food banks. They are unable to afford, heating their homes. They're unable to afford buying their groceries. They're unable to fill their tanks if they are district nurses. Now, how are we expecting people to work under these conditions? If you look at junior doctors, as you are well aware, they're going to be striking soon as well. And that's also because they're unable to afford living. A foundation year doctor earns absolutely nothing at the moment. And what for? There's absolutely no appreciation. Somebody needs to sit down and just look at all the aspects that need to be addressed. 12 hours in A&E is enough. 12 hours in A&E. That's all you need to do.